Why Capital Health Systems need an urgent care facility. What are the challenges and how can we overcome them? Capital Health Systems demographics. Capital Health Systems currently serves most of the Mercer County, Trenton area, which according to the U.S. Census is 84,964 people. There are two campuses that provide emergency and urgent care, but the distances and location becomes a problem when it comes to a specific services. The main campus is located around 16 miles from the center of the city it currently services. That means those past the center mark are more than 30 miles from the medical center. This data only refers to those with personal transportation. This is because public transportation is not available to reach the facility. 10.8% of the city suffers from some sort of illness. This is about 100 people who would be in need of minor urgent care services at least 2 to 3 times a year. Challenges. Patients concerned with having available the same treating physician and same quality of care. Patient flow and accessibility and location. With opening a new facility, we forecast patient flow would definitely not be a problem because a policy will be created that ensures most minor injuries can and should be serviced within a certain demographic location to avoid delays in medical treatment. To even up the ante, we could also refer follow-up appointments to the urgent care clinic. We could also allow or have our physicians with high patient base rotate with the urgent care facility to allow their patients in the immediate demographic to be treated by the physician they have grown to trust. This could be great for hematology, radiology, cardiology, and other services that are frequented by the elderly. This is currently at a 9.3% of the population, which is close to 8,000 people. Charging the same amount for the services which normally totals about $12,000 per head, according to Fitzgerald. That's an article titled The High Cost of Public Health Care in New Jersey. Staffing. We have already visited the staffing crisis with the previous proposal. The staff recruited from the recruitment event would also support the growing facility changes. I know in our previous proposal, we discussed expanding the current medical center with investment funds, which could also benefit the proposed urgent care clinic, allowing those patients receiving treatment for opioid addiction and pain management services to also be treated and monitored at the urgent care facilities, which would of course share information through the main campus through the EHR programming. Remember, I previously predicted the money available to be invested into the hospital should be used to recruit well-trained, credentialed staff and to raise our morale in the community of Trenton, which currently has a population close to 85,000 residents. This was always the goal. We are now attempting to divide the investment capital to suit the urgent care proposal as well. Policy and demand. The Senate, numbering 989, the State of New Jersey 218th Legislature Bill, was introduced in January of 2018. This asks for the number of patient to nurses to be lowered to ensure the quality of care that the United States has placed on medical care is being followed accordingly. This will free up more hands at the main campus that previously were occupied with minor medical emergencies. The opening of the urgent care facility will allow minor medical emergencies, illnesses, and other treatments to be administered within the immediate medical area of the potential patient.